Introducing Jules' new clinician report. Jewel has always created a client report with just one simple click. Now with that same click, a clinician report is created as well. Two reports with just one click. For example, if your client takes the online questionnaire and emails it to you, you combine that with QEG data that is already processed. The client report and the clinician report are created automatically. Almost all of the suggested protocols in Jules' clinician report can be created via the knowledge base for Discovery, Atlantis, 3.0, 4.0, and GP8E. This slide shows a partial sample of both reports. The client report is the same as usual, listing the client's name, age, and symptom, along with a lot of data in many pages. The clinician report on the left is for your eyes only. If you're tweaking it with the three filter design, there are your two inhibits in the reward. Those are the suggestions. If you're doing QEG Pro Z-scores, whether it's Surface or S-Loretta, here are the suggested sites. If you're doing Joule Z-score training, here are the suggested sites. If you're doing a tweak, a three filter design, these are the sites. If you're doing a two-channel sum squash, notice the sum squash is a two filter design with a reward and an inhibit. But if there is no suggested reward, then it will be a one filter sum squash. There's also recommendations as far as using beta SMR is concerned, or just C4 SMR. HEG, PIR, and NIR are commented on. Photic stim suggestions, ISO, UR, or low frequency training suggestions. And the symptom specific means this is what is often done for that particular disorder. It's not based on data, it's based on common practice. So let's go over the new clinician's report again. It has symptom comments, protocol suggestions with filter recommendations, QEG Pro Z-scores, Surface and Loretta, Joule Z-scores, bipolar and monopolar, two-channel monopolar, amplitude, low frequency, HEG, photic stimulation suggested, and almost all protocols are ready to be created in Joule's knowledge base. In conclusion, the client plus the clinician report has now made neurofeedback easier. Neurofeedback has simplified the entire processing of selecting and creating protocols. Why are several protocol options listed? Because clients learn in different ways. Sometimes they learn with QEG Pro Z-scores, sometimes they don't. Sometimes they learn with Joule Z-scores, sometimes they don't. Maybe we need amplitude training or low frequency training or photic stim or HEG. Find out how the client learns best. Use Joule suggestions to take the client to where they need to go to better mental health and happiness.